In a telephone interview with the newsroom on Thursday, Government Advisor Dr. Jennifer Westford said that the government is continuing its engagement with striking healthcare workers and the Guyana Public Service Union, GPSU. But while majority of the issues that push the healthcare workers to down tools have already been resolved, Dr. Westford said more time and negotiation is needed to resolve the issues related to COVID-19 risk allowances. One of the major issues for the nurses in the issuance of COVID-19 risk allowance, and while the government has set aside some $150 million in the 2020 emergency budget for frontline workers, Dr. Westford said the substantial issue will not be resolved with a click of the finger.
All of the issues that we have been dealing with so far, most of them have been resolved, and that's resolved on the ground. Most of them are issues that could have been resolved and can be resolved, and they're being done.
My final question.
Other issues that cannot be resolved immediately are being addressed also.
And what are those? That is what I was going to ask. What are the outstanding issues?
I don't think I wish to say that to you, but most of them are administrative issues within the various institutions.
And could I ask specifically if you were able to resolve the issue related to risk allowances?
That is the issue that will not be resolved immediately. That is one of the issues that will have to be resolved with discussions and negotiations.
Okay.
That is not something that can be resolved by the snap of your finger.
Meanwhile, on Wednesday, President Irfan Ali scolded the striking nurses for breaking the law, even as he promised momentous improvements on their salaries and working conditions in the next 5 years. President Ali, during an interview with NewsSource, said even as the nurses are making their demands, they must understand that there are laws and those laws have to be followed.
Whilst we know that they're operating in a COVID environment, just like every frontline workers, and there is greater risk, we appreciate that. We have to work within the confines of affordability and the economy, and I want to assure the nurses that this government is committed to ensuring our promises and our commitment to them over the 5-year period is realized, and I can assure them, Gordon, that their lives and their families' lives is going to improve tremendously.
The president gave no commitment on risk allowances, but pointed out that under the $150 million, frontline workers at the Georgetown Hospital have begun to receive their allowances. Kurt Campbell, Newsroom.